calamitous ramifications.
We'll hear of shortages or non-availability of essential COVID-19 case management drugs across the country, with nearly 800 health workers infected with 9 deaths.
If this trend persists, there would virtually be just a few health workers available to attend to patients, even as COVID-19 cases in Ghana keep rising.
And top story is always brought to you by Gassem Cement, the nation building Vodafone. The future is exciting. Ready. My name is Evans Mensah, and they are on the front lines of the fight against the coronavirus. And today, they united to lift the lid on a general breakdown in multiple aspects of Ghana's fight against the coronavirus. They warn of, quote, imminent calamitous ramifications for Ghana's health sector if government fails to act. For the first time since the outbreak of COVID-19 in Ghana, the leadership of the Ghana Medical Association, the Ghana Registered Nurses and Midwives Association, the Health Services Workers Union of the TUC, and the Government and Hospital Pharmacists Association addressed a joint press conference. They disclosed that so far, 779 health workers have been infected with coronavirus. 9 have died. An unspecified number of health workers, they say, are also currently in isolation, awaiting their results. I want to give you the detailed breakdown they provided today. 190 doctors have been infected with 4 deaths. 410 nurses and midwives also have the virus with 1 fatality. For health services workers, 156 of them have been infected and have suffered 3 deaths. There are also 23 pharmacists who have been infected with 1 death. Now, listening to the president of the Ghana Medical Association, Dr. Frank Ankobia, outline the reasons the high infections among health workers is threatening to shut down the health sector.
The major causes of this unacceptably high rate of infection among health workers could be attributed to the following. 1. Inadequate and erratic supply of PPEs to health workers, both in quantity and quality. 2. General breakdown or non-adherence to infection prevention and control protocols in most facilities, together with shortages or complete lack of disinfecting agents in some facilities. 3. Non-disclosure or concealment of information from health workers by facility managers when colleagues test positive for COVID-19 at the workplace. 4. The delays in receipt of COVID-19 test results for patients being managed on wards, resulting in increased exposure of health personnel to the virus. 5. The breakdown or inadequate contact tracing within facilities. 6. Lack of designated holding bays for suspected cases in some facilities. 7. Delays in the closure of wards or facilities for disinfection following exposure to COVID-19 patients. 8. Apparent disregard of the safety protocols by some health workers and patients who visit facilities. This rising infection rate among health workers is a matter of great concern because it negatively affects staffing levels and results in mounting work pressure on the few health workers at post. If this trend persists, there would virtually be just a few health workers available to attend to patients, even as COVID-19 cases in Ghana keeps rising.
So that warning there about how this may affect the health sector. Without nurses, without doctors, without health services workers and pharmacists, as you just heard there, it will affect the availability of these health professionals to attend to people, if not for COVID-19, other health complications. They also disclose a general breakdown in many aspects of Ghana's COVID-19 fight, including shortages or non-availability of essential COVID-19 case management drugs across the country.
National associations are gravely concerned about the increasing COVID-19 case count in the country, especially the daily case count. A lot more symptomatic and very ill patients who require inpatient care are presented to our health facilities. The current state of affairs has the potential to overstretch the already fragile health system as well as impact negatively on the care of non-COVID-19 patients. The national COVID-19 response is also fraught with a lot of challenges, including shortage or inadequate personal protective equipment for health workers in particular, periodic shortages or non-availability of essential drugs for case management, reduced testing capacity in the midst of increasing daily case counts, as well as huge delays in getting test results for patients, sometimes up to 3 weeks or even more. This situation is not the best, especially with its attendant high risk of viral exposure to both health professionals and the general public at the various facilities. Inadequate human resource for specialist care, inadequate intensive care units, or a complete lack of same in a lot of regions in the country.
And as we speak tonight, we've had 854 new cases as has been recorded today. 854 new cases, more cases than Germany. And Germany used to have daily cases in the thousands when we used to have a few hundreds. Active cases 5,129. Confirmed cases to 22,822. That's total number of confirmed cases. Deaths 129. Recoveries 17,564. Now the health workers made the following demands.
By this press statement, we entreat the government to take swift and practical measures to avert the imminent calamitous ramifications. To curtail the spread and win the fight against COVID-19, the group prefers the following measures. Government should, as a matter of urgency, ensure the following to help curtail the spread of COVID-19 in the country. Regular provision of adequate PPEs for all health workers at all times. Intensification of COVID-19 preventive and stigma education among the general public. Government, through the security agencies, should ensure strict enforcement of all COVID-19 safety protocols without fear or favor. Transparent and adequate dissemination of information to expose workers whose colleagues have tested positive for COVID at the workplace. Expand COVID-19 test centers and their capacity throughout the country, together with readily available test kits to prevent undue delays in obtaining test results. Government must ensure that test results are available within 24 to 48 hours. Again, all health facilities must mandatorily create holding bays to detain all patients who are suspected to have contracted COVID-19. There should be functional infection prevention and control committees in all health facilities. We wish to state with much trepidation that Ghana will be treading on dangerous grounds if the government fails to act accordingly.
I want to bring in now the Deputy General Secretary of the Ghana Medical Association. We'll also be speaking with the nurses representatives, the Ghana Registered Nurses Association. We booked to speak also with the Ghana Health Service boss, Patrick Kumabaje, who hopefully will get to join us because he's agreed to, as we make attempts to try and get to the bottom of some of the grave matters that the health workers have raised today. Titus, I'm grateful that you could join me here on Top Story. I read your statement and you use the words great trepidation. First time that all of you came together to address a particular press conference on the subject, a united front there. Before we even get to the specifics, why this approach? What's happening?
Yeah, good evening, Evans, and good evening to our listeners, and good evening to all healthcare workers in the country. I think we wanted to send a very clear signal to two groups of people, to the general public and to government, and by extension our employers. And we think that we have been making isolated statements and talking about the burden of this disease on healthcare workers, but we are not being taken seriously. So we wanted the Ghanaian public to know the gravity of this situation on the healthcare workers in the country. And we also wanted government to see what the reality is as far as all of us are concerned. And that was why we took this approach. And it's something that affects all of us.
When you read the statement, and of course, listeners have heard the details now, you get the impression that almost all aspects of the national response isn't working as it should. In fact, some of the words you use is even more stark. You talk about complete breakdown in some of these aspects. It's pretty chilling to hear.
Yes, it is a reflection of what is happening on the ground. Some aspects are working, but the key indicator is how many health workers are being infected and how many are dying. And if everything was working well, we would not have expected this amount of disease burden among healthcare workers. And we are getting complaints every day across the country. And that is why we had to put it just as it is.
You say, for example, I mean, something I didn't know before today, that there's a general, when it comes to the drugs for the treatment and management of COVID, you talk about it being either non-available or sometimes you have shortages as well. I mean, since when has this become an issue? Because, I mean, I haven't heard this before. I've heard the challenges with the facilities being full, pressure on health workers, but drugs to treat, it's also in short supply or not available.
Yes, and so you realize that we have different categories of the disease. From mild to moderate disease, we are giving people immune booster supplements. Those are readily available. So when we get to the critical phase, our data from the ground is that the anti-malaria now drug that we are using for antiviral, which is the hydroxychloroquine and chloroquine, now are available. In the past, we were having shortages of hydroxychloroquine, but we've started local production and that is available. But the critical one, which is what is needed, is what we call anticoagulants. And to be very specific, I'm trying to use terms that everybody will appreciate. A group of heparins we call the low molecular weight heparin. An example is clexane, another example is fragmin. Now, when this disease started, as part of its evolving pathophysiology, we began to understand that most of the people who sometimes die without any underlying pathology are dying from what we call coagulation problems, blood clotting in their system. So at the treatment centers, this drug is used in high doses and it's not readily available. There are shortages every now and then. There are some higher drugs who sometimes use them on compassion grounds. They are in our treatment guidelines, but they have never been used in the country. In fact, if you remember, when our very senior colleague, the late Professor Jacob Plandreau passed, there was some story about a drug having to be airlifted with a presidential jet into the country. That particular drug, if someone needs it urgently today, we will not have any more in the country at all. So it is part of our treatment guidelines. It is higher up there. We are not using it yet, but we need to have some in case we get to that point. But the frequently used ones like clexane, fragmin, if you talk to the people at our treatment centers, they are in short supply. And so we needed to come out for the Ghanaian to hear us. People make donations of PPE. People can also decide to donate these medications. The pharmaceutical companies can help. And if there is help, these are the areas we are looking for in terms of drugs.
Also joining me now, and please stay with me, Titus Bayo. Also joining me right now is David Tinkran. He is the General Secretary of the Ghana Registered Nurses and Midwives Association. Mr. Tinkran, thank you for your time here on Top Story. Your members have been hardest hit, if I may say so, based on the statistics I was providing, in terms of the number of infections. There are more doctors dying 4 to 1 when it comes to nurses, but you have 410 nurses and midwives currently infected. Many more, I guess, have been awaiting their results, and so they are in isolation. There's a warning that you issued today in the statement. You're afraid that if this continues, there'll come a time when you won't have enough nurses generally in the health system.
Good evening, Evans. Good evening to your listeners, and good evening to my brother, Dr. Titus Bayo. Indeed, that is true. And based on the statement that we issued, it is true that obviously if more and more people are being asked to step aside, then the rest, they are going to break their back in taking care of the good people of this country. And the time will come that obviously we may not have anybody to take care of the sick anymore.
I wonder though, you've been sounding this alarm, and you have a direct line of contact to the Ghana Health Service and the health officials, the ministry, etc. What is it that they've been telling you about these concerns? That this is not, some of them I'm hearing it for the first time, but many of them I've heard it before. Clearly from what you're saying, it's gotten worse now. What sort of reactions are you getting from the authorities?
Even they keep assuring us that they are doing their maximum best to be able to assuage to our demands. But obviously, as the day go by, we realize that not much of these concerns are being addressed. And these are the results that we have. So these staggering statistics obviously point to one thing, that we are not being listened to, or the right decisions are not being taken based on science, as we've been made to believe.
But what impact is this having on morale among those who are still working?
It's having significant impact on them, and that impact is in the negative. Why am I saying this? Because if your brother gets tested positive, and it means that you who is negative is going to break your back and to do more than you were previously doing. All right, and if that person is not properly handled or treated, then you'll be demotivated, and that is what is going on.
Titus, with the Ghana Medical Association, I see number one item you point to explain why we're having these high infections among health workers is the inadequate and erratic supply of PPEs to health workers in quantity and quality. We were told several times at the government press briefing that this challenge has been fixed. You say that's not true?
Definitely, it's not true. And once again, good evening to David, my colleague. It is not fixed. PPEs are consumables, and PPEs are in high demand. If it is fixed, we won't be talking about it. You can't fix it in a day and then go to sleep thinking that you fixed it, because these are consumables we use daily, and we are talking about the right quality, depending on where you work in the hospital and the kind of patient you are facing and what you are supposed to be using in terms of PPE. So if you distribute some few cloth masks or distribute some few medical masks, you cannot say that you have supplied enough PPEs. Even when we are in certain areas, you need to use the N95. Some people are giving even the ordinary surgical masks. You may go for supplies and the whole unit is giving one box, or sometimes it's few counted for you to use for a week. How is that practically possible? So people will come into work and will have to spend time trying to find something to protect themselves before they get to work. And I don't think it is something government has ever denied. They know that the PPE and its supply system is not adequate. And it's the number one complaint we get from our members across the country. We don't know whether, I think there is a supply and there are distribution challenges. We had suggested in one meeting to government that we saw the use of the military to distribute PPEs to the second cycle schools. Why can't we employ something like that if the PPEs are available to distribute them directly to facilities quickly, rather than a situation where somebody has to go and apply for it from the regional medical stores, from central medical stores to regional medical stores to the hospital stores, then it will be given out in piecemeal to people when the consumption is going on daily.
Also, one of the key things I see that you talk about is testing. That there's reduced testing capacity in the midst of the increasing daily case count, as well as huge delays in getting test results for patients. There's an update today from the regular briefings that we get from government at the Information Ministry. Mr. David Tinker, I wanted to listen to the head of virology at the Noguchi Memorial Institute, Professor William Ampofo, detailing the efforts government is making currently to fix that particular challenge and others.
So I'm glad to report that the first shipment arrived on Saturday with the flight that, using the strategy of the flight that brought back the returnees. So we did get a significant quantity of laptops on Saturday. Another flight arrives today. I can just give you some of the figures. We have about 150,000 swabs, sample collection medium. We have over 100,000 KN95 masks. We have over 700,000 nitrile isolation gloves. We have 260,000 autoclave bags. We have PCR tests to do 500,000 tests. We also have microcentrifuge tubes. We have cryovials. We are buying new PCR machines, and we also buying what we call glove boxes that will enable us to do some work in some of the labs. So we put together a comprehensive program which has been funded by the Ministry of Finance to support the labs to provide PCR testing.
Mr. David Tinker with the Ghana Registered Nurses Association, you just had the update on what is coming and what would come in the future. Does that give you any comfort?
Well, Evans, it's reassuring, but that is not enough, and especially if we are to go strictly by the laborious nature of our supply chain system, that is not going to help, like what Dr. Title said. Okay, we are not in normal times, and therefore, if you want the system to work as if nothing is at stake, then we are going to have challenges. They should find an alternate and appropriate means of distributing these items, whether they are laboratory reagents or whether they are test tubes, whether they are PPEs, to the various facilities, instead of dumping them in the central medical store and for it to run through the normal way things are distributed. I think we need to re-look at the way the items are distributed. But obviously, if we've been given this assurance that more of such equipment and reagents have been imported or have arrived in the country, that means we can clear the backlog as much as possible. What we need right now, because of the hikes or the spike in infection, is to be able to get all-time results, okay? So that when you get exposed within a matter of hours or a matter of or even a day, you know your status, and that becomes very easy for us, okay? Because that is the reason why our nurses and doctors are getting infected, okay? Because patients are admitted on to ordinary wards, samples are taken, and it takes donkey days before the results are realized. And in all these, it puts everybody in danger. So I'm reassured somehow by what the biologist said. But what is important is that we need to dispatch these items as quickly as possible to the areas of need.
I want to read you something you said in your statement. You say that you made some demands and recommendations. If these aren't addressed, we are facing what you call an imminent calamitous ramifications. What are these exactly? What in the layman's terms, what does it look like for the health sector?
It doesn't look good for the health sector. That's why we initially indicated that the time will come that you will come and you won't find any nurse, any doctor to take care of you any longer. It's one of the calamitous situations we're talking about. At the same time, if we are getting more symptomatic patients that need critical attention in terms of ventilators and the rest of it, and we are going to have that situation on our hands. These are some of the things that we're talking about here.
Titus, for the doctors, this so-called imminent calamitous ramifications, what is it exactly?
Well, Evans, just as my colleague said, it's similar, but I will just make a statement on the testing before I tell you what this means to us. The first one is that we are asking if we are satisfied. We have heard these figures before. We will only be satisfied if we can get our results quick. That is the indicator, not the quantities that have been brought. We hear these figures all the time. What you and us, the media, the general public, everybody should help us track is that with this, whatever has come in, how long is it going to take us to get the results? That is the key performance indicator. That is what is endangering our lives. So that is what will satisfy us, not figures. So I want to see that. But the imminent calamitous ramifications we are talking about here in Evans is that we are having a situation where our human resource is limited for critical care. And if some of these people already are breaking down and more breakdown, then we'll have people who will need care and will not get that care. We'll have what we call non-COVID deaths going up, where people who need other health services will not have. And let me bring this to your attention. If you take away the southern half of this country, the entire northern half and all the regions in there is no capacity to handle critical cases under proper ventilation. Perhaps Tamale has a small capacity, but the upper regions, the Bono region, Ahafo region, Western region, all these other places, there's no capacity for critical care. So if we do not tackle this thing now and we get to that stage, then the calamity we are trying to avoid will come and to affect both the general public and us.
Well, I'm grateful that, gentlemen, you could join me on Top Story. That is the Ghana Medical Association's Deputy General Secretary, Titus Bayo, and you also had the General Secretary of the Ghana Registered Nurses Association, Mr. David Tinkran there. We had arranged to speak to the Ghana Health Service boss. We're still trying to reach him. When we do, we would try and put a few of the concerns raised by all the health professionals, Ghana Registered Nurses Association, the Ghana Medical Association, the Government and Hospital Pharmacists Association, all of them today at a joint press conference, put to him and get some answers. There's no way you run out of things to do during this period because Vodafone has got you sorted with too much data. Now double the data at the same price. So whether you are taking an exciting masterclass or binge watching Netflix series or bringing a party to Zoom, you now get too much data for today and too much bonus from midnight till 4 a.m. That's even more fun and way more than you're paying for. Dial hash star 700 hash to get 3 GB data for 10 CDs, 8 GB data for 20 CDs, and 20 GB data for 50 CDs bundles. Stay home and stay connected with Vodafone because with too much data, there's almost nothing you can do. Newsnight starts right now.